The president of the Israeli Headache Association is going to talk about this synchronization of alpha waves in migraine disorder when the entire cortex is disorganized.
Thank you. This is basically a work that I've been done with Dr. Mark Deutsch, who is sitting here with us today. Thank you very much, Dr. Deutsch, for coming to Israel. So, slides, yeah. So EEG provides an extraordinarily rich signal. It is also very safe and relatively inexpensive. And for 85 years, it has been used to study migraine. Success in finding a way to diagnose migraine was generally modest because of a lack of analytical tools. And the great hope has been that it could one day be useful for diagnostics. Now, with the eruption of machine learning, there are powerful analytical tools to decipher meaningful aspects of the signals. And in our study, machine learning is used to extract one of these aspects. It is widely believed that patients with migraine with aura do not behave normally during the interictal period. And it is easier to study the interictal period mainly because patients would rather be tested for migraine while they are not having a migraine attack. I'm about to present a preliminary communication or an initial report. We've just begun a more detailed IRB-approved expanded study with many more patients, and our main immediate priority is to record the EEG of many more patients so that we can improve our biomarkers for migraine with aura. Global desynchronization is a term. It's okay. So global desynchronization is a term that we coined here to express the idea that there is now evidence that the entire cerebral cortex is abnormal in a migraine with aura patients' resting state. The concept of global desynchronization provides a new perspective on the basic nature of migraine and a new way to think about this disease. That this synchronization may represent global misconnectivity. So, some basics about the EEG. The brain generates signals that travels along axons. These signals are shielded by myelin. The EEG signals are believed to come from the exposed cell bodies. How does electricity reach an electrode on the top of the skin? It must traverse the cortex and white matter, and then the meninges, bones, skin. This is the result of what is known as volume conduction. It can be thought of as a parallel universe that works alongside of axonal conduction. This activity is believed to move at great speed. The hills and valleys that we call EEG waves are believed to come from generators in the cerebral cortex. They are also believed to be the product of large collections of neurons and not single neurons. Current dipole sources is the concept of a vector with positively and negatively charged ends that are located in position in the cortex. It simultaneously aligned with the electrical field. The image above shows an arrow which is a current dipole source. The ovals represent the electrical field spreading out in 3 dimensions towards the yellow dots, which are the scalp electrodes. We decided to focus our analysis on the alpha waves because a literature search suggested they tend to be abnormal in migraine. The diagram has many little lines between surface electrodes. They are present just to illustrate the idea that electrical activity involving pairs of electrodes can be synchronized. This diagram is not our actual findings. Each colored line corresponds to synchronization between two electrodes. By synchronization between electrodes, we mean that there is an activity in one which mirror that in the other over an epoch in time. An easy way to understand this is to think of the alpha waves one finds in O1, O2, OZ electrodes at the back of the brain when the eyes are closed. The heels rise and fall in near-perfect synchronization. This is the electrode diagram for the electrodes used in our study. They are based on what is known as the 10-20 system for spacing the electrodes. The nose is at the top, O is occipital, F is frontal, T is temporal, C is central, and P is parietal. And the even numbers 2, 4, 6, 8 refer to the right hemisphere, and the odd numbers 1, 3, 5, 7 refers to the left hemisphere. The Z refers to an electrode pace on the midline, and that the smaller the number, the closer the position is to the midline. The study was approved by the Ontario Institutional Review Board. The participants consisted of 10 migraine with aura patients diagnosed according to the ICHD criteria, and 10 normal control individuals with no history of migraine. All subjects were tested in the interictal period. All subjects were simply sitting on a chair with their eyes closed and asked to relax. And as I said before, we have just begun a more detailed study with many more patients, and this is only a preliminary report. This is a raw EEG of a resting, eyes closed, no light, migraine with aura patient. This is 1,000 frames corresponding to 1 second of EEG. It has been filtered to only show the alpha waves. If you zoom in on gross inspection, you can see many instances of the hills and valleys rising and falling at the same time. This means they are closely time locked. This is what is meant by hyper-synchronization, and hypo-synchronization is the opposite. We did the same to the controlled group. And why alpha waves? Because fluctuations in alpha oscillations control the timing of perceptual processing. And increased lower alpha band power could explain the behavioral differences in migraine compared to the control group. Now, the goal of this slide is to illustrate the general concept of paring down from a large number of electrode pairs to a small number of salient hyperconnected pairs, and to identify salient connections between electrode pairs. We do this by a series of steps. On the right, we see an example of just 4 pairs of electrodes that are salient. Hyperconnected pairs are believed to be surrogates for connections between electrical generators, which may be deep in the brain, as illustrated by the blue lines on the right. This diagram is a pictorial representation of the previous slide. After EEG was recorded, we performed the routine act of frequency filtering to extract only the alpha waves. The second step is to calculate the phase lock value, PLV. So Sayari et al. Developed the alpha phase lock values to quantify relationships between brain regions to try to understand migraine. So for each pair of electrodes, we calculate their phase using Hilbert space. You don't have to know what it is, but then we subtract the phase to obtain phase differences between two signals, and finally we calculate magnitude by taking the exponential of the phase. The resultant value is called the phase lock value, or PLV, between the pair of electrodes, which is basically a tool to directly measure synchronization of peaks and depressions seen on a gross inspections of EEG. So the PLVs, phase locked values, are scored out of 1 for each electrode pair in the entire cortex. With 32 electrodes, there were 512 pairs. Migraine with aura patients were compared to normal controls. If a phase lock value is close to 1, then they are closely synchronized and assumed to be closely connected. A threshold was set at 0.7 or greater for hyperconnectivity, and at less than 0.3 for hypoconnectivity. And the slide illustrates a table showing what we refer to as counts for electrode pairs for each of the 32 electrodes. As an example, the first row is for electrode FP1, which is a left frontal electrode. There were 4 other electrodes that were hyper-synchronized with it, and 15 that were hypo-synchronized. The yellow highlights that you can see on the left side, on the left of the slide, show the most salient hyperconnected electrode, which was F8, a right frontal electrode, and the most salient hypoconnected electrode, which was C4, a right pre-post central gyrus electrode. And the table on the right shows results for the p-values, less than 0.0001 for the phase lock values for electrode pairs. We have selected F8 because it was the most salient finding for hyper synchronization, and you can also see the names of the 15 electrodes that it was hyper synchronized to. For example, there were 5 other frontal electrodes that were hyposynchronized F8, including FP2. At the far right of the diagram, we see the 18 electrodes that were hyposynchronized to C4. It starts with FP1, which qualifies this pair as a frontal-to-frontal hyposynchronization. The conclusion that F8 is probably a major hub or node for hyper-synchronization of the alpha waves in the resting brain of a group of patients with migraine with aura, and that C4 is a hypo-synchronized hub. So we may conclude that where there is hypersynchronization, there is hyperconnectivity. And where there is hyposynchronization, there is hypoconnectivity. It makes sense. Each electrode has a generator based on the proximity of regions of the cerebral cortex to the closest electrode, and the references for the most likely locations in the cortex for the activity found in F8 and C4 can be found at 2 studies. The first by Rogers et al. Was published in Frontiers in Neuroscience in 2018, and the second study by Kim et al. Was published in PLOS ONE in 2017. So the estimated most likely generator for F8 is the right inferior frontal gyrus, and the estimated most likely generator for C4 is the right post-central gyrus and the right pre-central gyrus. C4 is at the border between the pre and the post-central gyruses, so the generator could be one or the other or both. Our study demonstrates that all 32 electrodes had both hyper and hyposynchronization abnormalities when migraine with aura is compared to normal controls. This suggests that the entire cortex is affected in migraine with aura as compared to normal controls. It also provides evidence that certain electrodes such as F8 and C4 are mainly affected. The right inferior frontal gyrus is strongly implicated in hypersynchronization. This suggests that it is a hub. It may be sending messages to many other areas of the brain, as illustrated in the table that I showed before. And the right precentral and post-central gyrus are strongly implicated in hyposynchronization, and this suggests that these areas are dysfunctional. So hypersynchronization suggests hyperconnectivity, and hyposynchronization suggests hypoconnectivity for generators of the EEG waves. The main value of the study, the preliminary study, is to help us to understand group differences, how the migraine aura patients differs from normal controls, because the findings occurred at any interictal day. They might represent a fundamental latent state for migraine with aura. It actually helps us to understand that for migraine with aura patients, the problem is not limited to inflammatory processes or vascular changes, but also to dys-synchronized cortex, which may be the main and initial denominator to start this cascade. If so, then a new and very important question arises: would repairing the interictal abnormalities result in clinical improvement or possibly even a cure? Do we need to develop a new generation of treatments that should aim to normalize this latent state? We believe that the signals are there. We need to find the best recording conditions and the best analytical tools to decipher these signals, and that's where the machine learning comes in. Our hope for the future is that by changing the focus of treatment from the attack, the pain, the nausea, the vomiting, the neurogenetic inflammations that occur, to repairing the underlying latent electrical state, patients may not develop the symptoms. Maybe this is what the anti-epileptic drugs do, but not effectively enough and with too many side effects. Thank you.